Kanye, are you still having a bad headache?
It's gotten worse.
Here, drink this. You should come inside and rest.
I can't. My pumpkins are thirsty. I've spent the last 3 months growing them. I can't abandon them now just because of a little headache.
Let me do that.
No, you always overwater everything.
Kanisa, your hands look so swollen. So does your face.
I'm fine.
Look at them.
Fine. I'll rest for a little bit.
Kanisa, your face looks more swollen. Did you go back outside to work in the garden?
No, I haven't moved all day and my headache is still so bad. I'm actually getting worried. I remember my community healthcare worker Nomsa saying something about danger signs.
What are those?
Danger signs are things to watch out for because they could be caused by a dangerous medical complication. Now that I think of it, headache and swelling of hands, face and feet were some of the signs.
What? Why didn't you tell me before?
I didn't want you to stop me from working in the garden. You've seen my pumpkins. They didn't grow that big on their own.
Kanisa, did you forget about the pumpkin growing inside of you?
Of course not.
So, what are the other danger signs?
Severe headache, abdominal pain, fits like seizures or convulsions, not feeling the baby move after 28 weeks of pregnancy, any vaginal bleeding, fluid draining from the vagina before 37 weeks of pregnancy.
So, what are we supposed to do about your headache and swollen hands and face?
I don't remember. Can you call Nomsa, my community health worker?
She wants you to go to the nearest clinic immediately because you're having such a bad headache. She's also concerned because your hands and face are swollen and the swelling is more than you've had before. So you will need to have a blood pressure checked.
Oh, so we need to get there as soon as possible.
Yes, but you shouldn't walk at all. I can see if Mandla will let us borrow his car.
That might take too long. During one of her visits, Nomsa and I made an emergency plan for situations like this. The fastest way for me to get to the clinic is by taxi. I even saved up some cash for this in the box under the bed. Kanyisa, I'm glad you came to the clinic right away. If you had waited, there could have been life-threatening complications for you and your little one. Most pregnancies don't have complications, but they can happen to anyone. It's important that you knew the danger signs to look out for and had a plan for getting immediate medical help. I should thank my community health worker for that. I would have been terribly stressed without the emergency plan we made. You have a good community health worker. Now, we're going to take good care of you and make sure that you stay healthy and rested until it's time to give birth to your beautiful baby.
Yes, Kanye. You need to rest. That means letting me help you with household work and even watering your pumpkins.